Welcome to the Bald Brad Show. In this episode, we have a clip here between Rand Paul and Anthony Fauci regarding vaccines and royalties. And folks, these two do not like one another. The last clip I think we played of them two on the show was Anthony Fauci going, "Excuse me, Senator, you have no idea what you are talking about. Excuse me, Senator, again, you don't have the slightest idea with what you're talking about." So this has to be a good one. And these two are matching up once again for, I don't know, freaking round 4 or round 5. So I have a feeling it's going to get kind of interesting. As always, if you want to join us here on the Bald Brad Show or heck support a conservative, make sure to hit that like and subscribe button. Share this link with your friends and family all over social media. With that being said, let's jump into this.
Dr. Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?
Right now, there's not enough data that has been accumulated, Senator Paul, to indicate that that's the case. I believe that the recommendation that was made was based on the assumption that if you look at the morbidity and mortality of children within each of the age groups, 0 to 5, 5 to 11.
Right. There are no studies, and Americans should all know this. There are no studies on children showing a reduction in hospitalization or death with taking a booster. The only studies that were permitted, the only studies that were presented were antibody studies. So they say if we give you a booster, you make antibodies. Now, a lot of scientists would question whether or not that's proof of efficacy of a vaccine. If I give you 10, or if I give a patient 10 mRNA vaccines and they make protein each time, or they make antibody each time, is that proof that we should give 10 boosters, Dr. Fauci?
No, I think that is somewhat of an absurd exaggeration.
Well, that is the proof that you use. Your committees use that. That's the only proof you have to tell children to take a booster is that they make antibodies. So it's not an absurdity. You're already at like 5 boosters for people. You've had, 2 or 3 boosters. It's like, where is the proof? Now, I think there is probably some indication.
I think the Prime Minister of Canada's had like 2 or 3, and I believe he's had his second diagnosis of COVID in like the last couple months. So there's even politicians in America that have had like 5 boosters, folks, and they've had COVID twice since April. So this whole thing of like these vaccines work, and hopefully I don't get removed off YouTube here, but a vaccine traditionally is supposed to help you not get the disease. Well, I mean, you'll contract it, but you'll virtually have no symptoms. But these just kind of limit the symptoms in some cases. In other cases, just basically doesn't eliminate the symptoms whatsoever. You still feel horrible and like crap. And he's here saying, look, there's no studies out there to show that 0 to 5 aren't going to do basically anything, but you're still going to chauffeur this stuff out to our children.
For older folks that have some risk factors. For younger folks, there's not. But here's the other thing.
Right.
There are some risk factors for the vaccine. So the risk of myocarditis with a second dose for adolescent boys 12 to 24 is about 80 in a million. This is both from the CDC and from the Israeli study. It's also in the VAERS study, remarkably similar for boys, much higher from boys than girls and much higher than the background. The background's about 2 per million. So there is risk and there are risks. And you're telling everybody in America just blindly go out there because we made antibodies. So it is not an absurd corollary to say if you have 10. In fact, you probably make antibodies if you get 100 boosters. All right? That's not science. That's conjecture, and we should not be making public policy on it.
So, Senator Paul, if I might respond to that, we just heard in his opening statement, Ranking Member Burr talk about his staff who went to Israel. And if you look at the data from Israel, the boosts, both the 3rd shot boost and the 4th shot boost, was associated with a clear-cut clinical effect, mostly in elderly people, but also as they gathered more data, even in people in the 40s and the 50s. So there is clinical data,
but not in children.
Not in children. So this is what politicians tend to do. And I'm calling Anthony Fauci a politician because at the very beginning, I advocated for this guy. Not any longer. This guy's bought, folks. At least this is what my opinion is. This guy's bought. He's bought by all these companies, and he's trying to conflate these studies to cater towards children when in actuality they should be catered towards somebody else. And this is what Rand Paul's calling him out on.
Well,
Well, see,
again,
here's the thing is you're not willing to be honest with the American people.
That's right.
So, for example,
He's a politician.
75% of kids have had the disease. Why is the CDC not including this in the data? You can ask the question. You can do laboratory tests to find out who's had it and who hasn't had the disease. What is the incidence of hospitalization and death for children who've been infected with COVID, subsequently going to the hospital or dying? What is the possibility if your kid has had COVID, which is 75% of the country's had COVID, what is the chance that my child's going to the hospital or dying?
if you look at the number of deaths in pediatrics, Senator, you can see that there are more deaths
Of
in
people who have had
pediatrics.
it, of people who have had the
Pediatric-
disease.
Senator, we also know from other studies that the optimal degree of protection when you get infection is to get vaccinated after infection. And in fact, showing reinfection in the era of Omicron and the sublineages, that vaccination.
But you can't
follows-
answer the question I asked. The question I asked is,
This should worry you guys. This should worry you when you have a doctor that's the highest paid person in United States government, and he's not able to answer a simple question that a senator's asking him. Why is he beating around the bush like Karine Jean-Pierre, Jen Psaki, or Joe Biden, like all these other politicians? He shouldn't be. He should be answering clear-cut questions, but I'm telling you, this guy's been bought. He's corrupt. I don't believe a damn thing this guy says, and I hope he gets out soon because I'm so tired of Anthony Fauci telling us how we should live and what we should do and all these other things. When it's like, look, if you would have just acted like a doctor before and answered everybody's questions honestly, rather than beating around the bush and wanting all this vaccine pushes and all this other stuff, wouldn't do jack crap for the most part. And again, I'm vaccinated, I'm pro-vaccine, but you to sit there and say, oh, it's going to do one thing, in actuality, it does something else, or it doesn't do something else, however you want to phrase it, in which context, I'm not a fan of his handling of what he did.
how many kids are dying and how many kids are going to the hospital who've already had COVID? The answer may be zero, but you're not even giving us the data because you have so much wanted to protect everybody from all the data because we're not smart enough to look at the data. When you released data earlier, when the CDC released the data, they left out the category of 18 to 49 on whether or not there was a health benefit for adults 18 to 49. Why was it left out? When critics finally complained, it was finally included.
Not to mention, they also inflated the numbers by like 70,000 plus too. So all this stuff's coming out. It's wild, folks, on just the manipulation of these numbers that they pushed during COVID. And that's why a lot of people say, oh, trust the science, trust the science. No, I'm not going to trust all the science. I'll read the damn data myself. I'll determine which variables are lacking or which variables should be in there, which ones are confounding, which ones are lurking. And I'll be able to read the damn study myself. And like he's saying here, the American public isn't stupid. We can read studies for the most part and be able to determine what's right and what's wrong. And so when we call them out on this stuff, they can't give answers, which is exactly what's being displayed right now.
Because there was no health benefit from taking a booster between the 18 to 49 and the CDC study. Another question for you. The NIH continues to refuse to voluntarily divulge the names of scientists who receive royalties and from which companies. Over the period of time from 2010 to 2016, 27,000 royalty payments were paid to 1,800 NIH employees. We know that, not because you told us, but because we forced you to tell us through the Freedom of Information Act. Over $193 million was given to these 1,800 employees. Can you tell me that you have not received a royalty from any entity that you ever oversaw the distribution of money in research grants?
I don't know what he's about to say, but this could totally go my way, right? By saying the guy's been bought. I'm just curious here to see. And maybe that's what he's trying to go with, Rand Paul, here, to say this guy's bought, he's corrupt, and he's trying to make a point here without actually explicitly saying it.
Well, first of all, let's talk about royalties.
That's the question. No, that's the question. Have you ever received a royalty payment from a company that you later oversaw money going to that company?
I don't know as a fact, but I doubt it.
Well, here's the thing is, why don't you let us know? Why don't you reveal how much you've gotten and from what entities? The NIH refuses. Look, we ask them. The NIH, we ask them whether or not, who got it and how much. They refuse to tell us. They sent it redacted. Here's what I want to know. It's not just about you. Everybody on the vaccine committee, have any of them ever received money from the people who make vaccines? Can you tell me that? Can you tell me if anybody on the vaccine approval committees
It's yes or no.
ever received any money
Are you
from
going to
people
let me
who make
answer
the
a
vaccines?
question? Soundbite number one, are you going to let me answer a question?
Wow.
Okay, so let me give you some information. First of all, according to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act. So let me give you some example. From 2015 to 2020, the only royalties I have was my lab and I made a monoclonal antibody for use in vitro reagent that had nothing to do in patients. And during that period of time, my royalties ranged from $21 a year to $700 a year, and the average per year was $191.46.
It's all
Get that,
redacted, and you can't get any information on the 1800
Paul,
scientists.
your time is
So
long.
we want to know whether
Senator
or not
Paul.
people got money from the people who made the manufacturing
Senator Paul, your
vaccine.
time is long over expired. I gave you an additional 2.5 minutes. The witness has responded. We are going to move on. Senator Sanders.
There you have it, folks. And I'd be interested to know more about those royalties. Again, he went from like what, $21 a year to $7,700 a year, and going, well, this is the average. So, I mean, it seems as though with that type of average that he gave, he's more or less on the low end of those royalties. Just the way the distribution of the data would have to be is that you would get more of a right-tailed distribution curve. So maybe it doesn't. Maybe he's not getting royalties. Maybe he's getting paid in other ways. I don't know. We'll have to see. This is just the way I am thinking based on how Anthony Fauci answers his questions. Very political, very defensive when he doesn't need to be. He just needs to answer the questions that is being asked of him. He's just a doctor. He's basically somebody, I don't know if he's subcontracted by the federal government or he's actually a entity and an employee of the federal government itself. I'm not too knowledgeable on that, but either way, he just needs to answer the questions, but he doesn't want to do that. He wants to just act like a politician, very similar to Joe Biden and the rest of the Democrats. He's in bed with them. I can't wait till this guy gets out. It's shocking that this is the highest paid guy in government. I keep bringing that up because of his handling of COVID-19, and he's still pushing out to get booster shots for children when, again, you don't need to get a booster shot. Hell, you don't even need to be vaccinated technically as a young person. So all this stuff still being pushed out by Anthony Fauci, still being pushed out by the Democrats, still being pushed out by the left progressive outlets. So, folks, it's just crazy. But there you have it. You have a discussion between Anthony Fauci and Rand Paul. As always, folks, support us here on the show. Leave us a comment down below on what you think of Anthony Fauci. Do you like the guy? Are you tired of hearing him? Are you tired of hearing the voice, Senator? All these things. Let me know down below. Again, I know I repeated this, but hitting that like and subscribe button really does help support the channel. And with that being said, I will see you later here on The Bob Brat Show.